Chairman, we are ready to begin.
Good morning, DeLauren. If you will conduct the roll call of board members, please.
Yes, Chairman. I will begin with Roger Folsom,
Here.
Tommy Hopkins,
Here.
Kathleen Ruth, Norman Boyd,
Here.
Robert Coles,
Here.
David Cruz,
Here.
Shane Mobley. For your record, Chairman, Shane is on the call. Cynthia Rucker,
Here.
Anthony Williamson. Chairman, that completes my roll call.
Thank you, DeLauren. Good morning, everyone. We have a quorum, so we can conduct business. So we hereby call the meeting to order. In your information previously sent were the minutes from March the 12th. I didn't hear Dr. Kathleen Ruth might not be present. If not, Tommy Hopkins, have you had a chance to review the minutes, and would you make a motion for approval?
Yes, they've been previously sent. I make a motion we approve the minutes.
I have a motion for approval of the March 12th minutes. Any further discussion, additions, or corrections? Hearing none, all those in favor of the motion signify by aye.
Aye.
Opposed, no. Minutes are approved. Thank you. Thank you, Tommy. Opening comments this morning, we have a little work in front of us. We have 2 items for final adoption and 3 for initial adoption, and several items to entertain this morning. However, I fully recognize that from some of us that our thoughts are around blooming azaleas, beautifully manicured greens, and egg salad sandwiches and a peach ice cream sandwich over at Augusta. So I appreciate all of you being present for this, and I know our thoughts will drift toward Augusta occasionally this morning, so understand that. With that, we'll move into the Commissioner's report. Commissioner Burt.
Good morning, Mr. Chairman, members of the board, and members of the staff and the public who may be listening. I want to echo the chairman's comments. As I sat here, I was trying to decide what I was most happiest about, and one of those is Masters Week. The other is spring, but probably the big winner is the fact that the General Assembly has left town. So I'm have all kinds of reasons to be blessed today. And hopefully our folks today can knock in a few birdie putts for you guys here with our agenda. As far as the session, we did get a waiver authority for a 1915C waiver, that a bill that we were supporting. It passed and hopefully will be signed by the governor, which will help us with the severely mentally ill folks to get better support services to keep them out of hospitals and emergency rooms. A quick update on the rural health project that we've been talking about for the last many months. We have a advisory council that we have to set up, and we will be putting up a public notice asking for nominations for that advisory council. This is an important role for us to get feedback from people in rural Georgia that are in the healthcare space, to make sure that our programs are doing what they're intended, which is to improve outcomes, financial stability, and access to care. We certainly will be looking for people who have expertise in value-based purchasing, quality, and outcomes, along with other needed experience, and those will be outlined in that notice that we'll be posting shortly. We did have a overwhelming number of hospitals that were eligible to sign up for our AHEAD model, which is part of our program, which is the value-based purchasing model that we're trying to develop in conjunction with CMS. We had 87 hospitals sign up, which was well above our target internally. We're continuing those conversations, and we'll be having webinar with the healthcare facilities as early as next week. The final time has not been set, but it will be an opportunity for the health systems to ask us questions and get more information. And we're having to, build this plane as we fly it because it's never been done before. And CMS is still changing guidance on a daily or weekly basis sometimes. So we're going to get information out to those health systems as quickly as we can get it from CMS and figure out what it means for our particular program. We have technical advisory committees that are being set up, and those services, these are in the health planning area. So this is in the area of certificate of need. We'll be evaluating the cardiac services, both pediatric and adult, the PET services, which is the radiology screening tools that hospitals use mainly in the cancer space, mega voltage radiation, again, cancer therapy services in radiology, and ambulatory surgery services. So those 4 areas will be establishing a advisory council, and we'll be following their guidance to update our rules in those spaces. Quick correction, the webinar is not on ahead next week. That's on the DPPs, the directed payment programs that we announced last month were approved. I'm getting my webinars confused, but the one next week is about the DPPs. We're still working with our consultants to finalize the financial impact for individual institutions, and we hope to be able to share that again in a to be announced next week webinar. Next month, just for you guys' preparedness on the board, because of the legislative session, we'll probably have a lengthy agenda of things that we have to work through. So just kind of be prepared that meeting may last a little longer than normal. Those are my remarks, Mr. Chairman. I'm going to move forward with our employee milestones unless you guys have questions for me.
Any questions from board members for Commissioner Burke? Hearing none, proceed on, Commissioner.
Thank you. Obviously, we're always excited to announce these employee milestones and really appreciate all the work that our staff does to make our agency more effective and to handle what the public needs from us. Logan Nally Jr. at the Board of Dentistry at 25 years. Carlos Demetrius Matthews at HFRD for 25 years. Allison Wilcox at Medical Assistance Plan, 20 years. Michelle James, Office of Analytics, 20 years. Tamara Wilson at Medical Assistance Plans, 15 years. Sharon Thomas, HFRD at 10 years. Derek Gordon, State Health Benefit Plan at 10 years. Angela Hunter, Division of Financial Management, 5 years. Diane Jones, Division of Financial Management for 5 years. Aisha Williams, Medical Assistant Plans, 5 years. Alicia Barber, Medical Assistant Plans for 5 years. Patricia Newsom, Division of Financial Management, 5 years. And Young Chang, Board of Dentistry, 5 years. And at 1 year recognition, Bijal Soni, Commissioner's Office, she helps me on a daily basis. So I want to thank her for her year of service. Cariana Smith, Division of Financial Management, 1 year. Amy Juni, Division of Financial Management, 1 year. Sudha Ravindran, CMO Performance Management at 1 year. Joseph Booth, Medical Assistance Plan at 1 year. Tammy Wilson Scott, Medical Assistant Plan for 1 year. Janie Harrison, HFRD at 1 year. Obichi Osando, HFRD 1 year. Wendy Palmer, HFRD 1 year. Dana Alvera, HFRD 1 year. Colin Anthony Barr, HFRD at 1 year. Jason James, HFRD at 1 year. Catherine Jones, HFRD 1 year. Elisa Lenore Keller, HFRD at 1 year. And Toshia Wright McMillan, HFRD at 1 year. Lisa, you did some recruiting a year ago. I can see that. So, want to thank them for their service. One announcement for the board, and we'll be making a little more of a to-do about this later on, but Brian Dowd, who y'all have heard from many, many times over the years, has announced his retirement. So I wanted to make sure the board was aware of that. Brian is somebody who everybody at the agency goes to when they have a question, especially from a historical standpoint, and has this huge, deep reservoir of knowledge on healthcare policy in the state. And we want to thank him for his 28 years of service with the state of Georgia. And as I say, we'll be having a little more recognition for him at an event later on that we'll announce, but didn't want today's meeting to go by without you guys being aware that Brian is retiring, and I don't think he's in the room today, or I'd make him stand up and embarrass him. But I'm not sure you can embarrass Brian, but anyway. That concludes my remarks, Mr. Chairman.
Thank you, Commissioner. The board certainly echoes those employee milestones, whether it be 1 year or 25, or in Brian's case, 28. We appreciate your service. And Brian, we look forward to doing a more hearty congratulations to you at a later date. And thank you for your service, and thank each one of you that were named for your service. We'll move into our workload on the working agenda. And the first item for final adoption will be newborn screening rate increase. And Emily Hatchett, Senior Policy Advisor, will be presenting to us. Good morning, Emily.
Good morning, Chairman Polson. Thank you. And thank you, Commissioner Burke and members of the board. My name is Emily Hatchett, and I serve as Senior Policy Advisor to the Medicaid Director within the Medical Assistance Plans Division here at the Department of Community Health. So pending approval by the board and the Centers for Medicare and Medicaid Services, DCH proposes to increase the reimbursement rate for the Department of Public Health for newborn screening. This rate increase reflects the inclusion of 2 additional disorders approved by the Georgia Newborn Screening Advisory Committee and will be effective retroactive to March 15th, 2026. DPH has historically administered the state's newborn screening program and will continue to maintain oversight of this program. DPH will begin screening for mucopolysaccharidosis type 2 and guanidinoacetate methyltransferase deficiency. These additions to the newborn screening panel will result in a $7.80 increase to the current fee, bringing it from $88.33 to $96.13. The estimated cost impact is approximately $43,000 in state funds, $85,000 in federal funds, with a total for state fiscal year 2026 to right under $129,000. As part of the final adoption process, the department conducted a public notice and comment period. A public hearing was held on March 17th at 11 a.m. via Zoom audio, and written comments were accepted through March 24th, 2025. We received no written or oral comments. So given the absence of any concerns or objections during the public comment period, today the department respectfully requests the board's final adoption of these newborn screening rate increases. Happy to answer any questions if anybody has any.
Any questions for Emily from any of the board members? Hearing none, is there a motion for approval for final adoption?
Motion for approval, David Cruz.
Thank you, David. Has made a motion for final adoption. Is there a second?
Cynthia Rucker, second.
Cynthia Rucker has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Sounds like unanimously. Emily, thank you for your presentation.
Awesome. Thank you all.
Next item we will consider for final adoption is the Independent Care Waiver Program. And Maxine Elliott, Deputy Executive Director of Delivery and Administration Medical Assistance Plans, will present to us. Good morning, Maxine.
Good morning, Chairman Folsom, Commissioner Byrd, and members of the board. Again, my name is Maxine Elliott, and I serve here as the Deputy Executive Director for Service Delivery and Administration in the Medical Assistance Plans Division here at DCH. I am here today to present the Independent Care Waiver Program, or ICWP, for final adoption as part of the 5-year Section 1915C waiver renewal. The Independent Care Waiver Program remains a critical component of Georgia Medicaid's long-term services and supports continuum. As a reminder, ICWP serves adults aged 21 to 64 with severe physical disabilities or traumatic brain injury who meet nursing facility or specialized hospital level of care criteria. The program also continues to serve individuals beyond the age of 64 once enrolled. This waiver is essential because it allows eligible individuals to remain safe in their homes and communities while receiving the supports necessary to maintain independence, health, and quality of life, rather than requiring institutional placement. The purpose of today's request is to move from initial adoption to final adoption following completion of the required public notice and comment period. This renewal ensures continuity of services for current members, ongoing access to federal Medicaid funding, and alignment with federal requirements, including the Home and Community-Based Services Final Settings Rule. Importantly, this renewal does not introduce new services, and it does not change existing policy or operational practice, but instead reflects updated program assumptions, utilization trends, and cost projections. I will now briefly summarize the key updates included in this renewal. These updates are technical and programmatic in nature and are designed to strengthen program integrity, fiscal stewardship, and compliance with federal requirements. They include adjustments to individual cost caps based on an annual growth factor, updates to waiver slot projections based on current enrollment and utilization, addition of a standardized determination of need screening requirement, inclusion of telehealth assurances, incorporation of the Home and Community-Based Services Final Settings Rule requirements and assurances, updated projections related to self-directed service utilization, and updated utilization and expenditure estimates for the 5-year waiver period. Collectively, these updates ensure that the ICWP program remains sustainable, compliant, and responsive to member needs over the next 5-year period. I will now briefly address the required public notice and comment process. In accordance with federal requirements, the department conducted a public comment period, including a public meeting held on February 17th, 2026, and a written comment period that concluded on March 16th, 2026. At the conclusion of the comment period, no oral comments were received and no written comments were submitted. This outcome indicates that there were no concerns raised by stakeholders, no requested modifications to the waiver renewal, and that the proposed renewal is consistent with current program operations and stakeholder expectations. Based on the absence of public comment and the nature of the updates, this renewal represents a continuation and strengthening of the existing program rather than a change in direction. The projected cost for the 5-year waiver period remains as previously presented during initial adoption. Across the full waiver period, the total estimated state share is approximately $300 million. The total estimated federal share is approximately $597 million, and the total estimated expenditure is approximately $897 million. These projections support continued access to services while maintaining fiscal responsibility and alignment with Georgia Medicaid's long-term budget planning. Importantly, these investments also support a planned increase in waiver capacity from approximately 3,100 individuals in year one to approximately 5,500 individuals by year five, ensuring the state can meet growing demand for community-based services. In summary, the ICWP waiver renewal ensures continuity of services, strengthens compliance with federal requirements, maintains program integrity and fiscal stewardship, and supports individuals with significant disabilities in remaining in their homes and communities. Today, Chairman, we respectfully request the Board's approval for final adoption of the Independent Care Waiver Program renewal effective July 1st, 2026, pending final approval by CMS. At this point, I can pause for any questions.
Any questions from board members? Hearing none, we'll entertain a motion for approval for final adoption.
Hopkins, so moved.
Dr. Hopkins has made a motion for approval. Do we hear a second?
Shane Mobley, second.
Shane Mobley has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion appears to pass unanimously. Thank you for your presentation.
Thank you.
Next item on our agenda is also for final adoption, and it is the rules and regulations for birth center. And Melanie Simon, General Counsel, will present this item to us. Good morning, Melanie.
Good morning, Mr. Chairman, Commissioner Burke, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption for birth centers. These rules are found in Chapter 111.8.7 of the Department's Rules and Regulations. These proposed changes align current licensing requirements that are associated with transfer and transport capability with the Certificate of Need rules and regulations that were previously adopted by this board in compliance with Georgia law. An opportunity for public comment was held on February 17th, 2026 via Zoom, and written comments were due on or before February 19th, 2026. No oral or written comments were received regarding these rule changes. Accordingly, we respectfully request consideration for final adoption today, and I'm happy to answer any questions from the board.
Any questions from board members? If not, we'll ask for a motion for approval for final adoption.
Norm Boyd, motion to approve.
Norm Boyd has made a motion to approve for final adoption. Is there a second?
Second,
Cynthia Rucker has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Motion carries. Thank you, Melanie. You may proceed on to the next item, which is the hospital-directed payment. And this will be for initial adoption for us to consider.
Thank you. These rules are brought to the board on behalf of the Division of Medical Assistance Plans. The rules for hospital-directed payment program are found in Chapter 111.3.11 of the Department's Rules and Regulations. The purpose of these proposed rule changes is to update the criteria for the hospital-directed payment program to allow eligibility for children's hospitals to participate in the program consistent with the recently approved preprint authorization received from the Centers for Medicare and Medicaid Services. This is a relatively minor wording change that occurs in the definitions to simply remove children's hospitals from the exclusion in the definition of non-governmental hospital so that they will be allowed to participate in the program. An opportunity for public comment will be held on April 10th, 2026, which is tomorrow, 11:30 a.m. via Zoom. Written comments will be accepted on or before April 14th. And we do anticipate bringing these rules back to the board for final adoption in May, pending review of those comments. I'm happy to answer any questions from the board regarding these proposed changes.
Any questions from board members? Hearing none, we'll entertain a motion for final adoption. Or initial adoption, excuse me, my bad.
Motion for initial adoption, David Cruz.
David Cruz has made a motion for initial adoption. Do we have a second?
Shane Mobley seconds.
Shane Mobley has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion's approved. Melanie, thank you for your presentations.
Thank you.
Next item we will consider for initial adoption is the rules and regulations for nursing homes. Patrick Long, Associate General Counsel, will present to us. Patrick, good morning.
Thank you, Chairman, and good morning. Good morning, Commissioner Burke and members of the board. The Division of Healthcare Facility Regulation presents rules today for initial adoption for nursing homes. These rules are found in Chapter 111-8-56 of the Department's Rules and Regulations. These rule revisions will address two issues. First, the changes add a cross-reference to the existing rules and regulations for criminal background checks found in Chapter 111-8-12, so that all requirements associated with criminal background checks for owners, administrators, and direct care staff are contained within those designated rules. There are no substantive changes being made to the requirements. The second change is to update the requirements for health screenings for nursing home employees, including screening for tuberculosis. The revised tuberculosis language aligns with the recommendations of the Centers for Disease Control and Prevention. A public comment hearing will be held via Zoom on May 5th, 2026 at 1:30 p.m. Written comments will be accepted on or before May 7th, 2026 at 5 p.m. And at this time, we respectfully request consideration today for initial adoption of these rule changes, and I'm happy to answer any questions.
Any questions from board members? Hearing none, we'll entertain a motion for initial adoption.
Hopkins, so moved.
Tommy Hopkins has made a motion for initial adoption. Do we have a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
All those for no, or anyone abstaining? Motion passes. Okay, Patrick, we'll proceed on to also the rules and regulations for intermediate care homes.
Thank you, Chairman. The Division of Healthcare Facility Regulation will also present rules today for initial adoption for intermediate care homes. These rules are found in Chapter 111-8-47 of the Department's Rules and Regulations. And these rule revisions are substantially similar to the rule revisions that were just presented for nursing homes. A public comment hearing will be held via Zoom on May 5th, 2026 at 11:30 a.m. And written comments will be accepted on or before May 7th, 2026 at 5 p.m. And at this time, we would respectfully request consideration today for initial adoption of these rules changes, and I'm happy to answer any questions.
Any questions for Patrick from board members? Hearing none, we'll entertain a motion for initial adoption.
Norm Boyd, so moved for adoption.
Norm Boyd has made a motion for adoption, for initial adoption. We'll entertain a second now. I'm thinking some of you have already gotten ahead of me and you're on the course of the masters already, but
Second by
Dr.
David Cruz.
Rucker.
Cynthia Rucker has made a second for the initial adoption. Any further discussion? All those in favor signify by aye.
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 All opposed, no. Anyone abstaining? Motion carries. Patrick, thank you for your presentations this morning.
Thank you very much.
Next item is a resolution we will consider for the state health benefit plan, and state employer contribution resolution is what we will entertain. Louis Amos, Executive Director of the State Health Benefit Plan, will present to us. Good morning, Louis.
Good morning, Chairman Wilson, Commissioner Burke, members of the board. I'm Louis Amos, Executive Director for the State Health Benefit Plan, and I'm presenting to you a resolution regarding the state employees plan employer contribution rate. Whereas the state health benefit plan is comprised of 3 health plans: 1, a plan for state employees, the state employees plan; 2, a plan for teachers, the teachers plan; and 3, a plan for public school employees who are not eligible for the teachers plan, public school employee plan. Whereas pursuant to OCG 20-2-891, 20-2-918, and 45-18-12, the Commissioner of the Department of Community Health is permitted to combine the 3 funds supporting the plans together in order to pay benefits due under the plan, any of the plans. Whereas the state health benefit regulations 11-4-1-2 and provides that the board shall, by resolution, subject to the governor's approval, employ contribution rates. These rates may be a dollar amount for each member, a dollar amount for each enrolled member, a percentage of member salary, and any other methods permitted by law. Whereas the Amended Appropriation Act for fiscal year 2026 establishes an employee contribution rate of 20.264 of total salary for the state employees effective May 1st, 2026. Whereas the board and the governor wish to set the state employees plan employer contribution rate at 20.264 of total salary effective May 1st, 2026 until changed by board resolution. Whereas in order to support the financial stability, it is necessary and appropriate for the Commissioner and the State Office of Planning and Budget to be able to adjust monthly state employee plan contributions. And whereas the Commissioner is required to provide advance notice of any rate changes occurred during the fiscal year to impacted employers. Now, therefore, let it be ordered that the state employee plan's employer contribution rate for fiscal year 2026 is hereby set at 20.264 of total salaries effective May 1st, 2026, and continuing until changed by board resolution. And now, therefore, let it be ordered that the monthly state employee plan employer contribution rate for fiscal year 2026 shall be set on a periodic basis by the Commissioner at the percentage of total salary necessary to achieve an annual contribution of 20.264 total salary and fulfill the intent of the Amended Appropriation Act of 2026. Now, therefore, let it be ordered that the Commissioner shall take action necessary in order to ensure that employees required paid contributions to the state employee plan's employer receive proper and timely notification of all necessary contribution rates. I respectfully ask the board to approve, and now we'll pause for answer any questions that may be regarding this resolution.
Any questions from board members?
Mr. Chairman, David Cruz, just I guess a question about this is like a 30% reduction in rate, and that rate I think has been set for quite a few years. I guess just trying to understand a little bit about why that such a dramatic change and the plans for funding in the future.
Yeah, sure. So the state employees plan is funded in terms of OPEB, other employee benefits, is fully funded at over 100%. So the previous amount was 29.45. It is being reduced due to the fully funding for the OPEB fund for the state employees plan.
Any other questions? It's my understanding the board will need to approve this resolution, so we'll entertain a motion for approval.
Dr. Coles, so move.
Dr. Coles has made a motion for approval. Do we have a second?
Hopkins, second.
Dr. Hopkins has seconded the motion. All those in favor of approval of this resolution signify by aye.
Aye.
Anyone opposed, no. Anyone abstaining? Motion is approved for the resolution. Lewis, we'll move on to now the State Health Benefit Plan Pharmacy Benefits Manager Notice of Awards.
Thank you, Chair. The public notice here is the State Health Benefit Plan Pharmacy Benefit Manager Notice of Award. The effective date for this award will be January 1, 2027, and the requested action is approval of the notice of the award. I'm going to provide a summary as it relates to the procurement process. The Department of Community Health State Health Benefit Plan issued a pharmacy benefit invitation for proposals, or IFP, on August 4th of 2025. The procurement focused on selecting a highly qualified organization to partner on a multi-year agreement to manage self-insured active and pre-65 non-Medicare Advantage retiree pharmacy plan designs, which included claim processing, oversight, member services, maintenance of a robust network of retail and mail order pharmacies, support of clinical and medical management program, and compliance with relevant state, federal rules and regulations. A letter of intent to participate were due no later than August 11, 2025, and formal proposals were due no later than September 15th of 2025. DCH received 4 proposals in response to the IFP and completed a comprehensive evaluation of technical and financial information submitted by the bidders. Based on the result of the evaluation, a notice of intent to award was issued on March 18th, 2026. It's a correction there, identifying Express Scripts Incorporated as a successful offerer. Upon approval of this selection, a notice of award will be issued by the department and the implementation process will begin. Express Scripts will begin providing services to SHBP on January 1, 2027. The recommendation is for approval of notice of award for successful offer, Express Scripts Incorporated. I will now pause and entertain any questions that may come from the board.
Any questions from board members? Hearing none, we'll entertain a motion for approval.
Motion.
Move.
I think I heard Dr. Tommy Hopkins made a motion for approval, and is there a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion carries. Thank you, Lewis, for your presentations this morning.
Thank you, and thank the board for your support.
Is there any other business that needs to come before the board this morning? We've had a little bit of work. I think this was a training session for what the commissioner has indicated for the month of May. So we'll get a little bit of work out. Is there any new business needs to come before the board this morning? If not, thank all of you for your participation. Enjoy this beautiful spring day, and I hope some of us can get over to Augusta in the next few days. And with that, I wish you well, and we stand adjourned. Thank you.
Thank you.
Thank you.